We go now to our reporter Lora Windsor, who has more information on high blood pressure.
About 75 million people in the United States have high blood pressure. That's 1 in 3 adults. According to the American Heart Association, high blood pressure causes more than 54,000 deaths each year in the United States. We spoke to Dr. Bahram Eslami at Hoag Memorial Hospital Presbyterian in Newport Beach with more information on the causes and treatments for high blood pressure.
90% of blood pressures are called essential. That means we don't know the cause. But definitely, lifestyle, increased salt intake, lack of activity, and family history plays a significant role. 10% of elevated blood pressure, we call it secondary high blood pressure, and one might be able to find a cause. But the most important thing is to treat the patient with high blood pressure. Hypertension is called the slow killer. If you do not treat it, gradually will damage the end organ and cause complications.
What is high blood pressure or hypertension?
The normal blood pressure, ideal blood pressure, is 120/80 or less. We have a terminology called pre-hypertension. That would be a number of 120/139/80/89. These are the individuals that you first try to treat them with lifestyle changes, if all possible, to see if that's correctable, unless they have diabetes or they have multiple coronary risk factors that you would like to start them on medication in conjunction with lifestyle changes. Anything above that would be considered high blood pressure. In America, there are 50 million individuals with high blood pressure. And the probability of lifetime hypertension for people aged 50 to 65 is almost 90%.
What are the side effects and complications of high blood pressure?
The potential side effects and complications of high blood pressure would be stroke. There are 4 times increased chance of stroke in patients with hypertension versus normal blood pressure, and 6 times greater chance of heart failure in comparison to normal individual. High blood pressure also can cause end organ disease, kidney problem, eye problem, causes aneurysm, causes coronary artery disease, and arrhythmia, atrial fibrillation, which is a rhythm problem causing stroke. It could be associated with high blood pressure. The treatment of high blood pressure first involves the lifestyle changes, which again would be exercise, normal weight, and a good diet. Then would be the medications. There are a variety of medications, especially the newer medication with the least side effects. But the most important thing to achieve is to aim for a normal blood pressure. Unfortunately, only 1/3 of individuals who are known to have high blood pressure and take medication, they have optimal blood pressure control. Therefore, we need to be more aggressive, and we need to also increase the public awareness of the importance of optimal blood pressure control.
There's no question that high blood pressure is a deadly disease. If you suffer from hypertension, making a few lifestyle changes can possibly save your life. For the American Health Journal, I'm Lora Windsor.